Managers of public health facilities are calling on government to end the ongoing strike by the Medical Laboratory Professional Workers Union, which began on Tuesday, June 18, 2024. Now, this follows unsuccessful negotiations with the Fair Wages and Salaries Commission regarding the conditions of service for its members. The nationwide strike has left both inpatient and outpatient services as well as health facility managers in a state of disarray. ChannelOne News' Christopher Kevin Asima has been assessing the situation and brings us this report.
The Medical Professional Workers Union announced a nationwide strike effective June 17, 2024 due to lack of agreed upon condition of services for its members, a negotiation process that has spanned nearly 2 years. On Monday, June 3, the Medical Laboratory Professional Workers Union issued a strike notice to the National Labour Commission, Fair Wages and Salaries Commission, Ministry of Employment and Labour Relations, Health and Finance, as well as all relevant agencies. This followed the breakdown of negotiation with the Fair Wages and Salaries Commission. The union expressed disappointment with stakeholders, citing undue delay in concluding negotiations and the lack of financial clearance for the non-mechanized members as reasons for the strike. According to the Medical Laboratory Professionals Workers Union, the notice was issued in accordance with Section 159 of the Labour Act 2003, Act 651. The union membership includes the Christian Health Association of Ghana, teaching hospitals, health trainee institutions, Ahmadiyya Health Services Ghana, and the University of Ghana Medical Center, among others. Additionally, it encompasses laboratory professionals providing technical services in pathology laboratories and selected mortuary facilities across the country, including medical laboratory scientists, medical laboratory technicians, and medical laboratory assistants who deliver diagnostic services in clinical laboratories and blood banks under the Ministry of Health and allied agencies such as the Ghana Health Services and the National Blood Services. ChannelOne News checks at several public hospital labs in the capital revealed empty laboratory units and suspended services with no sign of laboratory professionals. At the Greater Accra Regional Hospital, management indicates that the strike is affecting efficient operation. Dr. Raf Ama, the medical director of the Greater Accra Regional Hospital, mentioned that management is making efforts to temporarily mitigate the situation.
We have set up a lab space within the emergency room and a lab space at the OPD. And what this seeks to do is to create a certain workflow for the lab tests to be done. And so for the OPD, they start at 8 and close by 3 when most of the OPDs have closed. And for the inpatient, they run 24 hours in 2 shifts of 12 hours. So when the lab tests are done, they are done 4 hourly at certain periods because of the logistical challenges we have. So at 8, 12, 4, 8, and then 1 late midnight at 11. So once the courier sends one batch of samples, they retrieve the previous test and bring it. So that's what we've tried to do to let the system run and not let patient care be affected.
Dr. Raf Ama also appealed to both the Medical Laboratory Professional Workers Union and the government to urgently resolve their dispute to prevent the problem from escalating further.
I know and hope that their grievances will be addressed and they are needed in the system to help the system to function efficiently.
Several hospitals and health services across the country are experiencing challenges, especially with blood transfusion and other laboratory service following the strike by the Medical Laboratory Professional Workers Union across the country. Management of these public health facilities are urging government to close deal with the striking professionals to enable them return to posts to aid health service delivery in the country. For ChannelOne News, I am Christopher Kevin Asima reporting.